healthy communication really boils down to is that it's more about context than it is content. Meaning it's not so much what you say, it's how you say it.
Welcome to AMC. I'm Dr. Greg Miller. Have you established healthy boundaries for your team? Today, Dr. Callie Seymour is going to provide 3 keys to healthy staff boundaries. You won't want to miss her advice on the specific categories of communication. If you find this video to be helpful, please click the like and subscribe buttons. Let's get started.
Hello, colleagues and friends. I'm Dr. Callie Seymour, one of your AMC instructors. And today we're going to help you discover 3 keys to healthy staff boundaries. You know, your effectiveness in leading your team will directly impact your effectiveness in leading your communities. In the area of natural healthcare, it is time for us to rise to the forefront and become the leaders in our communities. This starts with a great team, and a great team begins with us as leaders. So developing healthy boundaries with your team is critical. Key number 1 to healthy staff boundaries is gripes go up. And this is a principle that I love to live by when it comes to your leadership. Gripes go up simply means that when you have problems or complaints or things aren't going well, the worst boundary break that you could do is to bring those problems and complaints down to your team members and kind of dump all that on them. Another problem is when you bring those concerns lateral. So you're just processing those problems with a fellow colleague who's also in the very same position. So gripes don't go down and they very rarely go lateral. Gripes go up. And that's why it's really helpful to have a coach or a mentor or someone who's been through this before that can help you to both process what you're going through and what you need to do to come on the other side of it. So one healthy boundary principle is to make sure that you're bringing all gripes upline. Key number 2 to establishing healthy boundaries with your team, with your staff, is communication. Now, communication is a very complicated topic, but it doesn't need to be. What communication, healthy communication, really boils down to is that it's more about context than it is content, meaning it's not so much what you say, it's how you say it. So when you have to have difficult confrontations with your staff members, or when you have to clearly communicate the vision so that they can get on board, you have to prioritize your style of communication and your effectiveness. So communication is the second key to developing healthy staff boundaries. Now, within this broad umbrella of communication, it can really be broken down into 3 main categories. Number 1, be clear. Clear is kind, and clear is effective. Number 2, be consistent. Your style of communication is one thing, but the frequency of your communication is equally important. Your team needs to know when they can expect to communicate with you and in what manner you need to be communicated with. They need to know how you're going to communicate with them, right? So you have to establish a clear pathway of communication so that everyone can get on the same team and work towards the same goal, which is impacting your community and helping as many people as you can to reap the benefits, the rewards of drug-free, surgery-free care. Number 3 is context. So this is developing your style of communication in a way that pulls people to follow you, okay? This is about influencing your team and onboarding them with the mission that you've got. Context is the 3rd key to that. So communication needs to be clear, it needs to be consistent, and you need to watch your context. The 3rd key to establishing healthy staff boundaries is mission orientation. So one of the ways to develop Strong boundaries with your team is to, number one, let them know that you are behind them. Let them know that you're here both to serve the community and to introduce natural healthcare to them, your team members. So this starts by making sure they're on care plans, making sure they're understanding the benefits that come with chiropractic care and with establishing healthy lifestyle patterns. Part of getting them mission oriented is also sharing with them the impact that you're having. And this can be mastered by sharing testimonials with them, getting them involved in the patient interaction and the patient care. Establishing healthy boundaries with your team members is a critical way that you can establish your leadership in the community and really have the strongest possible impact. And we're here to help you do that.
Join us at our next training weekend, April 7th through the 9th. If you're new to AMC and would like a free guest pass to 3 days of material just like this, text us at 904-966-4996. AMC is your guide to becoming respected, effective, and valued in practice.